In the 1980s, the carrot industry was struggling. Not only were sales low, but waste was extremely high. Misshapen carrots didn't make the cut when it came to joining their perfectly formed carrot brethren on the grocery store shelves. These unfortunate orange castaways were thrown out before ever making it to the consumer. Carrot farmer Mike Urosic wanted to do something to change that and began experimenting with turning these wasted carrots into something consumers would want. Armed with a potato peeler at first and moving on to an industrial bean cutter, he began forming large deformed carrots into cute little 2-inch carrot tubes. The rest is history. In a Washington Times article, Roberto A. Ferdman writes, in 1987, the year after Urosic's discovery, carrot consumption jumped by almost 30% according to data from the USDA. By 1997, the average American was eating roughly 14 pounds of carrots per year, 117% more than a decade earlier. The baby carrot doubled carrot consumption. The article goes on to say that baby carrots account for nearly 70% of carrot sales today. Having encountered many normal carrots wasting away in our family refrigerator's crisper drawer prior to 1986, I can attest that had it not been for Mr. Urosic's visionary leadership, my lifetime consumption of carrots would likely have been nearly zero. The simple truth is that the regular carrot is too much carrot for a regular person. It's overwhelming. It's just too much to chew.
Welcome to the More Than Enough podcast, where we invite some of our friends to help you and some of your friends work together to provide more than enough, filling the biggest gaps for children and families before, during, and beyond foster care where you live. Here's your host, Jason Weber.
Hey, welcome to the More Than Enough podcast. Today's episode kicked off with a little history about the baby carrot. That veggie origin story comes from the opening to Chapter 7 from Until There's More Than Enough, Transforming Foster Care Where You Live. You may still be wondering, though, what do baby carrots have to do with foster care data? Well, for today's episode, we're going to do something a little different, and we're going to listen to the rest of that chapter and find out what it means to make data a meaningful, informative, and inspiring tool in caring for kids and families. So let's find out what baby carrots have to do with foster care data. In our desire to help people understand that we have a huge problem in foster care, we share big national numbers. In 2022, there were 368,530 kids in care, with 108,877 of them waiting to be adopted. While these are frighteningly big numbers and may be helpful to a point, they are not particularly compelling for most audiences. The numbers are just too much to chew. People in your church would likely be far more motivated by learning the number of children in foster care in your county or even in your zip code. That is a statistic they can do something about. Finding this kind of data involves a bit more work, but is worth it in terms of our ability to help people feel that their actions will make a significant difference. When you arm yourself with this kind of data, it completely changes your conversations with church leaders in your community. Pastor, 62 children are waiting for adoption in our county. How many of them do you feel our congregation could realistically rally around? Whatever number they give you, even if it's just 1 or 2, multiplied by the number of churches in your community, will likely result in more than enough for the waiting kids in your county. People in the nonprofit world have different feelings about data. To some, it feels too impersonal, too businessy. However, if we understand a few essential principles, we realize how vital data is to foster care transformation in our communities. Pay attention to the ones column. Years ago, when I was helping my daughter subtract large numbers for an assignment, she stacked the numbers and started on the left side in the thousands column rather than on the right side in the ones column. As you know, starting in the ones column is pretty important. When we look at foster care data, our strong inclination is to start with the numbers on the left, the 100,000s and 10,000s columns. We look for indications of trends and glimpses into the enormity of the problem we are facing. However, the first principle of handling foster care data is to pay attention to the ones column. It's the ones column that reminds us that every piece of data represents a life. As mentioned, in 2022, there were 108,877 children in U.S. foster care waiting to be adopted. It wasn't just over 108,000. There were 108,877. There are 7 children in the ones column. The problem is that 108,000 is a hard number to put names to, but 7 is not. A cursory online search of the Adopt US Kids website introduces us to 7 children: Amelia, Kara, Jose, Curtis, Jonathan, Crystal, and Gavin. When discussing statistics, strategies, and programs, we cannot lose track of these 7 kids. I don't know them. I don't know why they are in care, their favorite colors, or whether they like fish sticks, but I do know that each of them might very well have different answers to those 3 questions. The way we advocate, collaborate, and use statistics should always be informed by the knowledge that there are 7 children with names and favorite colors sitting right there in the ones column. Data is not about sharing statistics, it is about telling stories. Data can exist in different forms. Once it is collected, you might see it first in a spreadsheet. However, a number in a box on a sheet full of numbers and boxes is not compelling. A person might go to the next step, pull a number from that spreadsheet, and share it as a statistic. This, of course, is better, but it still leaves the audience with more questions than answers. What does that really mean? Statistics themselves can mislead, even when technically accurate. Finding the meaning behind the statistics we use is critical. Providing context is essential. Statistics can tell incredibly compelling stories if we let them. Database stories are as credible as someone sharing their personal experience, for example, I eat ice cream, but have the added benefit of being true for more than one person. 96% of Americans eat ice cream. Take that, kale chips. For example, I could tell you that in a given county, there were 122 children brought into foster care last year. I could go on to share that 81 of them were placed in foster homes in that county. Those are 2 useful statistics. But there's a critical and compelling story there if you ask the right questions. If 81 of the children who were brought into care last year were placed within their own county, what happened to the other 41? Who were those 41 kids, and why weren't they placed near the things and people familiar to them? What is true of those particular 41 kids? Are they generally similar in age range, or do they have similar medical or behavioral needs? The stats themselves don't tell you much until you probe for the meaning behind them. In this case, the simple answer might be that there were not enough foster homes in that county, but there's a good chance the reality goes deeper than that. You might find that most of those 41 kids required therapeutic care. A higher level of training is necessary for therapeutic foster parents. That county might have had enough foster homes numerically, but they might not have had enough of the right kind of foster homes. It may be that many of those kids were medically fragile, or there weren't enough foster homes in that county equipped to care for kids with those needs. I once heard an instance of a little girl with some serious medical needs. Because the closest available foster home that was equipped to care for her needs was so far from a major city, she had to be life-flighted to a hospital every time she needed care. So when we talk to others about the need, that context is vital to the story we tell. Churches in your county need to know that hurting kids in your community are being sent 4 hours away because the necessary local families have not yet been identified and trained. As a result, those kids cannot be close to the family members, teachers, and therapists they love. That backstory is a lot more compelling than the fact that there were 122 kids brought into care last year. The stat alone is just something to be sad about, but the story the numbers tell is one we feel compelled to do something about. Data provides a rallying point for collaboration. An essential part of getting churches and organizations to work together to solve a problem is getting them to agree on what the problem is. Data paves the road toward agreement about the problem. Several years ago in our county, a group of ministry leaders from several churches began discussing what they could do together. After discussions with local child welfare leadership, this group eventually landed on the fact that there were 62 kids in the county waiting for adoption. Many of those children were older and had a variety of special needs. This group began hosting multi-church recruitment events twice a year to highlight approximately 25 of the hardest to place children in the county. Each church involved sponsors a display table focusing on one child. That church is responsible for creating a table that captures the essence of that kiddo. If that child loves horses, the table is decked out with horse stuff. If it's trucks, that table will be a truck shrine. Each table at the event is then staffed with that child's caseworker and their CASA, court-appointed special advocate. The child is not present. Attendees then have the opportunity to get to know the children in our county who have waited the longest. This group of churches has seen tremendous success in finding adoptive families for these kids. But this action started with rallying around a number. Understanding the story behind the data helped these churches rally around a specific course of action that is easy to communicate to new churches. Data helps you cast a vision for where you are going. When the goal in your county goes from more to more than enough, the way data is used has to change. When the goal is more, the only number you need to know is how many kids are currently being helped. Then you just have to do a little better. That might lead to improvement, but it implicitly ignores the kids we are failing. However, when the goal is more than enough, you demonstrate that you and your co-collaborators have every child in view and are doing all you can to meet their needs. To do this, you will need some additional information. You will need to know not only how many kids need care, but how many families are currently available in your county. You will need to know how many additional families you would need in order to exceed that demand. As we've already stated, it's not enough to say that if we have 40 kids in care, we need at least 41 families to arrive at more than enough, because not all 41 families will be equipped to care for every one of those kids. You will need to find enough available families to enable good fit placements for older children, children with high therapeutic needs, and children who are medically fragile. While arriving at the optimal number will not be an exact science, our best estimate is that you will need at least twice the number of certified foster families as you have children in care. A word of caution here. When your county or state hears you talking about recruiting 2 families for every child in care, they may object. After all, they may not have sufficient resources to get that many families through the training and certification pipeline. But this should never be a reason for setting a lower goal. We can't settle for less. Admittedly, training and certification may need to be reimagined using other community resources to provide what our waiting kids need. For example, professionally qualified members of churches have volunteered to conduct training sessions or home studies. Also, part of attaining this goal will include retaining existing foster families by supporting them well. Therefore, we won't have to recruit all new families to reach that target number. We will keep more of the families we already have. However, we simply cannot settle for aiming at a goal that is less than what the children in our communities need. Data helps you understand where you are. It is safe to say that no one wants to waste their time on efforts that won't work. However, because good data outcomes can be complex to collect for local efforts, we don't necessarily know whether we are being as effective as we could be. Also, nonprofits can sometimes shy away from using data for fear that it will show that they are not being effective. They tend to rely on individual stories instead. Certainly, these are powerful ways to communicate with donors, but they should not be confused for evidence of effectiveness. Nicole Wilkie, the director of the Center on Applied Research for Vulnerable Children and Families at the Christian Alliance for Orphans, shares, "We need to be very comfortable with data that show us we're not having the effect we desire. Knowing what is working and knowing what is not working are equally valuable. Anytime we stop doing something that is not working, we make room for other approaches that might work. Your best chance of knowing what doesn't work depends on collecting good data." Data gives legitimacy to your movement. If you show up in a foreign country with a wallet full of US dollars and don't bother exchanging them for the national currency, your opportunities may be limited. You may also end up very hungry. Government and local businesses are 2 of the biggest allies in foster care transformation in your community. They are 2 very different institutions, but have one big thing in common. Their currency of choice is data. This is how they make decisions, determine priorities, and allot resources. If you want them to take you seriously, you will need to become comfortable handling the currency of data. Yes, but how? Discussions like this about data are polarizing. You are either fired up and have said amen 3 or 4 times over the last several paragraphs, or you are glazed over and drooling a little on your shirt. To be transparent, I'm a little closer to the drooling side of things when it comes to data. I can find it a bit overwhelming, but I know this about myself and intentionally collaborate with people who eat this stuff for breakfast. To operate a local foster care network, you don't have to be a data expert, but you should know one. So here's the good news for my fellow droolers. Building a local network doesn't require complicated data collection. Only collect the data you need. Figure out what pieces of data are necessary for the specific work you are doing and collect those. Here are 3 questions to answer with your co-collaborators about what data you should be collecting. Which data matters most to our partners in government? Which pieces of data are tied explicitly to our 2 or 3 most important goals? Which pieces of data will be the most compelling to our key audiences, churches, businesses, donors, potential families? How do I find foster care data that already exists? This can be one of the more challenging aspects of local foster care movement building. Generally speaking, data that is most useful in a local movement setting is 1, up to date, and 2, specifically local. When you do an online search for foster care data, you will likely end up with data from AFCARS, Adoption and Foster Care Analysis and Reporting System. This is the system the federal government uses to collect foster care data from state governments. This data is then analyzed, which takes time, and released in a preliminary report containing national data about a year after it is collected. A report containing state-by-state data is released 2 or more years after the data is collected. However, this report is neither up-to-date nor specifically local. This means that you'll be left presenting a problem to your community that is both 2 to 3 years old and too general to be locally compelling. However, there are better options. There are 2 primary paths for finding up-to-date and specifically local data. One of the most effective ways we found to get local foster care data is by going through the Freedom of Information Act, or FOIA, process. The FOIA process allows you to request specific data from your local state through a form or email address available on their website. The response time can vary from about 10 to over 90 days. The case is generally acknowledged and assigned to a records custodian or researcher who will either approve, partially approve, or deny the request, depending on data availability, cost, and state policy. In our team's outreach, we received a response for foster care data from over 90% of states through FOIA. The other path for acquiring local and recent foster care data is through building trust with the right people in your local or state child welfare office. They collect and use local and updated data all the time, but it's just not easily accessible to the general public. However, successful agencies and organizations often establish a relationship with the right person or department. They can often get monthly county by county or even zip code by zip code reports on foster care data. Just a warning, a simple phone call asking for foster care numbers is probably not going to yield the results you desire. Establish a relationship and be sure to help those you are building a relationship with understand your motives for seeking this data. When data makes things better. As mentioned earlier, we shouldn't be afraid of data that shows we are not yet achieving the results we desire. We don't collect data just to show people how great we are or to justify our existence. We collect it to make things better for children and families. A 2015 Forbes article describes how Tom's Shoes set out in 2006 to donate 1 pair of shoes to a child in poverty for every pair of shoes sold. This was an admirable goal, to be sure. In their first year, they gave away 10,000 pairs of shoes, and in their second, 200,000. However, they came to understand over time that their efforts were actually hurting local cobblers and communities around the world by disrupting local economies. Additionally, while they were putting shoes on children's feet, Tom's charity didn't address why they were going without shoes in the first place. Tom's used this information and pivoted. To address more systemic issues, they began donating items like birth kits that included a pad, gloves, and sterile equipment to cut a baby's umbilical cord. They haven't stopped donating shoes, but now attempt to source them from local shoemakers to stimulate local economies. This is an excellent example of how we can use data to help us discover that, despite our best intentions, we are not producing the results we intended, so we can shift and do better. When we shine a bright light on a wall we have just painted and reveal a thin spot in the paint, we don't walk away feeling sad for having been a lousy painter. We shine the light, find the thin spots, and fix them. Let data be your light bulb. There's something really important that happens when data stops being abstract and starts to feel real. It compels people to act, to make a difference. They see those local numbers and they know that there's something they can do about it. They know implicitly that more than enough is possible. Well, our team here at More Than Enough has seen this happen for so many of the folks that we work with, and we've seen the impact it's having in their own communities. So we wanted to share some of those stories with you. In a moment, we'll get to hear from a handful of foster care leaders from across the country about the local data point that inspires them to most want to make a difference in their community. We'll have that right after this. You know that more than enough is possible for children and families in foster care where you live. But somewhere between here and actually getting to that vision, you find yourself stuck on questions you can't quite answer. Questions like, how many foster and kinship families do we actually need in my county? And how many children are waiting for an adoptive family? And who else in my community is already engaged in caring for kids and families that I can work with? Here's the thing. If you want to get to more than enough, you first have to know where you are and who's there with you. That's why we created the More Than Enough dashboard. It gives you real, local foster care data for your county all in one place. You can also find others who are working locally, explore historical trends, track your community's progress over time, and easily share the data with others who need to see it. You can even embed your own county's dashboard directly on your website, making it simple to get more people in your community informed and engaged. Whether you're just starting to explore what More Than Enough could look like where you live, or you're already deep in collaboration and looking for data to sharpen your strategy, the dashboard was built for you. Just go to the show notes for this episode at morethanenoughpodcast.org and follow the link to explore the More Than Enough dashboard for your community. Let the data show you where you are and guide your community toward reaching more than enough together. Sometimes a single number is all it takes. Not a national statistic, but a local one. One that puts a name, a face, or a family to the right need in your own backyard. When people who are passionate about foster care encounter numbers like that, something shifts. They stop feeling overwhelmed and start asking a different question. What would it take for us to change that number together? So we reached out to foster care leaders from across the country and asked them the question, what is the data point that drives you most in your work? Here's what they said.
My name is Richard Roseland, and I'm a foster community missionary with Orphanos here in Memphis, Tennessee. The foster care data point that drives me the most is that here in Tennessee, we have the highest rate of foster care instability in all of the United States. Children are being moved 3 or more times in the first year of care to different homes for different reasons. So this is just one data point that continues to motivate me to love on the caseworkers who we're coming into contact with who are burdened with a lot of cases, to train and encourage and wrap around foster families so that the first time that something difficult comes their way, it isn't a call to the caseworker saying, hey, I need you to come pick up this child, but instead have people who can encourage them and love on them and let them know, hey, we can get through this, especially for those first few days and few weeks that are difficult, and provide as much support and care as I can.
I'm Jamie Bartlett. I serve on staff at Crossroads Bible Church in Grand Rapids, Michigan, and I'm also a part of our collaborative network in our area. And one thing that I learned early on is that about a third of foster care agency workers will leave their roles every year. And I had experienced the impact of that as a foster parent. Whenever we would change caseworkers, it was tricky and hard to navigate. But when I began looking at things from a more systematic level, I realized how hard it is on everyone. It's hard on the foster care agencies themselves, having to retrain new caseworkers pretty often. It's hard on the caseworkers who feel underprepared and overwhelmed. And so as a collaborative network, we really decided to lean in and listen to our agency workers, to meet regularly with them, to figure out what gaps there are and how we can fill them together. Honestly, we were not intending it to be such a focal point of what we do, but now that we are on year 3 of our collaborative work, we've really seen the fruit of focusing on the foster care agency workers.
I'm Tracy Rudd with Colorado Kids Belong. And when I learned that over half of the families that get certified to foster end up quitting within the first year, I thought, wow, we can do something to change that. I also learned that most of those families say that it's because of a lack of support, community support. We can for sure impact that number. So I work hard to create as many supports as I can through our Foster Friendly app and some other things in communities so that these families will feel seen and supported, and that when things get hard while they're fostering, they can continue moving forward and caring for those kids. I want to help families continue fostering stronger and longer.
My name is Liz Brzezinski with Bridge the Gap in Weld County, Colorado. In our county, we have 221 kids in out-of-home placements. And we know at Bridge the Gap that each kid needs multiple safe and loving adults surrounding them in their lives. And it drives me to change that number for the better, to ensure that each 221 kids has a family wrapped around them and a family that is supported, that they have coaches and teachers that understand more about what they're going through and how to connect with them and how to support them, to ensure that there are churches in our community that are looking out for these kids, praying for them, offering meals, offering rides, that there is support for foster closets for our families, that there's kinship support and grandparent support groups, to see that each one of those kids is wrapped around by a community that loves and supports them and shows them that every day.
I'm Carly Souza with Fostering Hope in Las Vegas, Nevada. Statistically right now in Clark County, 1 in 5 kids in care have been in care previously. And a lot of that, as we know from years of research, is it's generational. And it's hard to break negative generational cycles. And so we have tried to say, how can we step in and give these birth parents the support that they need to be able to maintain placement of their children once they have reunified? So we've started a class in partnership with 2 incredible marriage and family therapists here in Las Vegas, and we call the class Healing Our Past. And it walks through with these birth parents, what are their challenges that they experienced. So many of them were in care themselves as kids, and they don't have any family support, they don't have community support. And so being able to step in and wrap around those birth parents to be able to help them maintain placement of their kids once they've done the work to reunify, it's been really rewarding. Over the last year and a half, we have been able to walk with 12 biological families, which isn't a huge number, but of those 12, all 12 of them have maintained placement of their kids. We're just striving to help families be healthy and whole, and it takes an entire community to do it.
It wasn't the big numbers that moved these leaders. It was the small ones, the ones close to home, representing children, families, and social workers they know by name and serve every day. When data gets that specific, that local, it stops feeling like a statistic and starts feeling like a responsibility. And that sense of responsibility is what has rallied entire communities around a shared goal of changing those numbers for the better. Just like the carrots that almost didn't make it into the grocery store, sometimes the most powerful things come in smaller, more digestible packages. Special thanks to Jamie, Tracy, Carly, Liz, and Richard for sharing with us today. And thanks to our producers, Amanda Baird, who would say that collard greens are at the bottom of her vegetable food pyramid, and to Rachel Jackson, who didn't feel quite right about Brussels sprouts when she was a kid, but now that she knows that you can fry them and slather them with sauce instead of boiling them, she's all in. And of course, thank you to our audio engineer, Daniel Davidson, who really has a passionate vendetta against canned green beans. I had no idea. He said he literally cannot get them down. And regardless of the vegetables you love and the ones you just can't deal with, we're so grateful to you for the difference you're making in the lives of the kids and families that represent the ones column. Thank you for what you do. We're here to help you do it until there's more than enough.
This has been the More Than Enough podcast. Join us next time as we introduce you to more of our friends who are passionate about helping you and your friends work together to provide more than enough for children and families before, during, and beyond foster care where you live. Explore show notes and learn more at morethanenoughpodcast.org.